My name is Greg Bell. I'm the president and CEO of the Utah Hospital Association. We've recently seen a huge spike in cases. We're all trying to deal with the implications of COVID long-term and now Omicron, the latest version, the latest mutation. We felt it would be well after the first of the year and given what we've seen happen to pull together our experts from the state of Utah and our various healthcare systems and discuss with our press colleagues and the public what we might expect and what should be done. We're delighted to welcome you today, and I appreciate so much the colleagues who are joining me today. First of all, we'll have Dr. Michelle Hoffman, Deputy Director of the Utah Department of Health, Dr. Brandon Webb, Infectious Disease Physician and Chair of Intermountain Healthcare's COVID Therapeutics Committee, Tracy Nixon, RN, Chief Nursing Officer, University of Utah Health, Dr. Arlen Jarrett, Chief Medical Officer, Steward Healthcare, and finally, Dr. Marian Bishop, Emergency Department Physician, Brigham City and Cache Valley Hospitals, Mountain Star Healthcare. Welcome to our professional colleagues, and we'll start with you, Dr. Hoffman.
Thank you, Greg, and welcome everybody. I'm Michelle Hoffman, Deputy Director at the Utah Department of Health. Unfortunately, we're beginning the new year in a really dire position when it comes to COVID-19. Yesterday, we experienced a record-breaking day in terms of case counts, and today we've broken yesterday's record with 8,913 new cases. There are more people hospitalized than yesterday, 530. There are more people in the ICU than yesterday, 188. And unfortunately, we continue to have people die from COVID-19. We will report 13 new deaths today, including a child. Our testing locations are bursting at the seams. More than 41,000 tests were conducted in the state yesterday. People are spending hours in their vehicles waiting to be tested. If you are seeking out testing, we need your patience. You'll experience potentially very long waits. Come prepared. Similarly, our hospitals are bursting at the seams. Our hospital partners here today will address this further. But they are caring for more patients, especially patients needing critical care, with fewer staff than ever because they're out sick or have simply given all that they can possibly give. Monoclonal antibodies, which have shown so much promise as a treatment that can help prevent serious illness and hospitalization, are in critically short supply. If your strategy was to hedge on getting vaccinated and seek treatment with monoclonal antibodies in the event that you test positive, it is time to rethink your strategy. Omicron has taken over, and only one of the 3 publicly available monoclonal antibody treatments is effective against Omicron. As a result, hospitals and our other treatment partners have stopped using 2 ineffective treatments. Just a couple of weeks ago, we were treating more than 1,000 people a week with monoclonal antibodies. Last month at this time, we were ordering about 1,300 treatments per week. This week, we were only able to order 264. Recently authorized oral antiviral pills are in similarly short supply. We're only receiving about 220 courses of these pills each week. For the most effective oral antivirals and monoclonal antibodies, our statewide treatment capacity is less than 500 people per week. By our estimates, even the most highest risk eligible individuals, we would have 4,200 a week that qualify for these scarce 500 doses and treatment courses. There is some positive news. The one thing that is not in short supply or experiencing significant wait times to take advantage of also happens to be the one thing that is most effective at preventing cases, hospitalizations, and deaths. And of course, as you all know, that one thing is vaccines. Everyone 5 and older is eligible to be vaccinated, and as of today, everyone 12 and older is eligible for a booster dose. We need more people to start their vaccination series that have not. Only half of Utahns 18 and older have had their booster doses, the very best protection that we have against Omicron. We need everyone who is eligible to get their booster doses now. Thank you, Greg.
Go ahead, Brandon.
Dr. Hoffman, very clearly articulated, we have shifted into a true crisis phase. As the chair of the COVID Therapeutics Committee for Intermountain Healthcare and as a member of the State Crisis Standards of Care Committee, I've been working for almost 2 years now to make treatments available to Utahns who are in most need. And as Dr. Hoffman described, currently the amount of available treatment to Utahns is very, very limited. It's so limited, in fact, that roughly 1 out of 100 new test positive cases every day would have the availability of a treatment. And of those most eligible, like Dr. Hoffman mentioned, only 1 in 10. We live in an all-you-can-eat society where scarcity is a very foreign concept, and this has created a terribly difficult situation. We are following crisis standards of care principles to focus and prioritize the available therapies to the patients who are at highest risk, immunocompromised, and most vulnerable. These are the populations that most closely reflect the patients who are being hospitalized and who are dying of COVID-19. By following these principles, we can ensure equity and fairness and can also clinically prioritize treatment to the patients who are most likely to benefit. Unfortunately, what that means, however, is that many patients will not have access to these treatments. Like Dr. Hoffman also said, it's very important for the public to understand that the single most effective therapy for preventing hospitalization and death is to receive at least 2 doses of vaccination. Those who've wisely chosen to receive at least 2 doses of vaccination have tremendous protective benefit against hospitalization and death. We want to make sure that as we move forward into this most difficult phase, that we understand that we can't simply build a bigger boat. There simply isn't an opportunity to acquire more therapies. Our ethical imperative is to use the resources we do have at our availability to treat the patients who are at the most risk and highest likelihood of benefiting, and to do everything we can as a community to bring down those case numbers and to protect the vulnerable and the high risk. Thank you.
Tracy, and then Dr. Jarrett and Dr. Bishop.
Good morning. My name is Tracy Nixon. I'm the Chief Nursing Officer for University of Utah Health Hospitals and Clinics. And to add upon what you've already heard, I want to share with you a little bit about the impact of this surge on our ability to staff and take care of our community and our region. This is something we tried to prepare for 2 years ago when we went into this and started our planning when we were fully staffed. Today, our staffing is so incredibly limited because of the healthcare providers and workers that have left healthcare and their professions altogether. So we enter this point in this moment in time, I'm already dramatically understaffed. And now with the increase in staff out due to COVID related reasons, I am unable to care for the patients that we need to. We have closed beds in our hospital, one of the hardest decisions we've ever made. We are facing shifts where we are so understaffed that our staff are afraid to come to work. They're afraid to be here because they know we do not have the staff available to care for the patients in the way they need. On Tuesday of this week, in one of my care departments, I had 3 nurses leave because they can't do this again. They feel like we're going backwards. The new year always, I think, brings hope for all of us, and that we hope this looks differently, and to step into this new year and face such a dramatic increase in our COVID numbers, and to see ourselves back in this place and truly in many ways in a worse position than we were when we started this 2 years ago is incredibly difficult on our teams. We are not able to provide care for our community when we close our beds and when we don't have staff to take care of those patients. We are turning transfers away, people who need this level of care. We were on ambulance divert for 6 hours last night because our ED was overwhelmed with patients seeking care at a time when, again, we don't have staff and we've closed beds and we're unable to provide that. It is a dire time for all of us, for our healthcare teams in particular, to stand in this space again. Thank you.
Thank you, Tracy.
Thanks, Craig, and thanks to the Utah Hospital Association, Dr. Hoffman, and others, my other esteemed panelists. It's been a delight to work with a number of the people on this panel multiple times each week for the past 2 years. We've gotten to know each other as we've all tried to collaborate and focus our efforts on this pandemic. And I want to thank all of the folks who have joined this call to listen to what the hospital systems have to say. We've done this a few times, and I know that there's a lot of pandemic fatigue going around. Everyone's sick and tired of the pandemic and the inconveniences and miseries that it brings. I want you to know that there's no one that is more acutely affected by this fatigue than our frontline workers in the hospital. Our nurses, doctors, medics, technicians, therapists, social workers, multiple other people that work throughout the healthcare systems. These are our frontline workers, and they sacrifice, their families sacrifice for us. And I just want to let them know on behalf of all of the hospitals in state and the health systems that you are appreciated. You're doing a great job. We're grateful to you and your families. And we're so sorry that you have to be the witness to the suffering and sad departing of so many souls under your care. What a wonderful service you have given as you have tenderly and compassionately walked down that final path with so many, most of whom you don't know. And certainly you'll be blessed. We want to thank you. Thank you. You are truly angels among us. And as others have indicated on this call today, we're stepping into another great unknown of this pandemic that will probably be called the Omicron surge. Dramatic increase in cases. Omicron is much more contagious than others. We're still learning a lot about Omicron. We have some of the things that we've learned. We do have some hope that there will be lower hospitalizations and lower death rates with infected cases. But we have concern, and we're seeing that concern play out now, that even though there might be a lower rate, and we don't know that for sure yet, the number of people who are infected is so overwhelming that even a lower rate of hospitalization from these individuals translates into an overwhelming number of hospitalizations and possibly an increased number of deaths. We don't know yet. We have concerns. This is a dire time. And I want to add a message of hope and talk just briefly about some of the things that we can do, we ourselves can do. We have some very effective tools. They've been around for a long time, and we have refined these tools, and we know more about these tools as each passing month goes by, as we get more science behind them. There are 9 general categories of tools listed on the CDC site, but I want to just emphasize 4 of them. And it'll sound like a broken record because you've heard these so many times before, but number 1 on that list is vaccination. Vaccinations work, even against Omicron. We find with Omicron that it's especially important for people to have received their full vaccine doses, including the booster, those who are eligible. When you do this, we know that this is going to help, and that's something that each and every one of us can do. Second important tool is masking, wearing masks. Wearing masks does a number of things. It significantly decreases the spreading of the coronavirus, including Omicron. And it not only protects us, ourselves, from getting Omicron from others, but so much more importantly, it protects others from getting Omicron from us or COVID from us, especially if we didn't know that we had it. So wearing masks continues to be so vitally important. Third, avoiding large or poorly ventilated crowds. This is difficult to do, but in the next coming weeks and months, we may find that we just need to do this at a greater level than we've been doing in the past. This works. And certainly, if we're going to be in any sort of gathering, make sure you're wearing a mask. And then the fourth thing I just want to mention is testing. If we feel ill, we should get testing. Well, what good does this do? Well, the main good thing that it does is that it may motivate us. If we have a positive test, it may motivate us to put that mask on when maybe we didn't wear it before. It may motivate us to not go to that family party that we really wanted to go to. But if we know we have a positive test, we can follow the Department of Health guidelines for isolation and quarantining. They've been greatly reduced based on science. They're not as onerous as they have been in the past. So vaccines, masks, avoiding large gatherings, and testing. Why now? I'll just add, well, the Omicron surge is upon us. It's building up to be far beyond anything we've seen so far with this pandemic. These tools work, but we must choose to use them. Thank you.
Thank you, Arlen. Dr. Bishop.
Thank you. I'll start by thanking the Utah Hospital Association for a chance to be a part of this important conversation, and also to all of my colleagues from other hospital systems that have collaborated together over the course of the pandemic. As an ER physician who has spent the last 2 years taking care of these patients, it's an honor to be here and to talk a little bit about my experience in the emergency room and to represent HCA. Some of what I say will be a little bit of a repeat of what has been said, but I'll try and perhaps maybe give a little bit of that frontline perspective. Each of the phases of the pandemic has brought its own challenge. And as people have already stated, the challenge of Omicron, we hope isn't severity of illness, but definitely is going to be the volume of sick patients. And even if, from a percentage basis, we are seeing fewer very sick patients, if more of us get sick all at the same time, that is going to be a very big challenge indeed. The tools we have to fight the virus, as people have said, are not perfect, but they're profoundly helpful. And I would echo everything everyone has said about vaccines and masking. And in particular about vaccines, I would just provide experience that I've had in the emergency room. I've taken care of more COVID patients over the course of the last 2 years than I can count. I've now seen enough patients with breakthrough infections, people who are immunized, who've had both doses, and sometimes a booster, to tell you that those are two very different diseases. They don't look very much alike at all. Unimmunized patients, I have to give a pretty grim prognosis to when they land in the emergency room. We're always incredibly relieved to hear that a COVID positive patient has been immunized, because we can tell them to plan for what is likely to be a much easier course of illness. And that's always a happy thing that I can do. I'd repeat the statistics that are currently on the Utah Department of Health website that talk about unvaccinated Utahns are almost 17 times more likely to die from the virus than vaccinated Utahns. And unvaccinated folks are 9.2 times more likely to be hospitalized. These statistics completely, 100% bear out what my on-the-ground experience is telling me in the emergency room. There is protection from the vaccine, and I would echo everything everyone else has said, that it's worth getting. Second, masks can be incredibly important, especially in large groups. I know sometimes they're a hassle to wear, but I think being willing to wear them across the course of the next 6 to 12 weeks could be a real blessing to the friends and neighbors that we care about, and also to protecting ourselves. I'm incredibly proud of the work my coworkers and I have done in the last 2 years. I work with a cohort of fierce, passionate people, and I'm just so proud to be a part of them. But we need your help, and I'm just asking you to bear with us for another short period of time and to give us some support so that we can continue to help you. Please get vaccinated and consider it if you haven't been. Be willing to wear a mask when you're in a large group, and stay at home if you don't feel well. You deserve the rest, and it will protect all of us as well. Those of us working in hospitals every day would be so grateful for these small measures, and I think it would help us all get through this together.
Thank you to all our panelists. Let me now place some questions to our panelists. Let's combine Max Roth's and Lincoln Graves' Dr. Webb. They're asking, what is it about Omicron that has caused such a massive spike in cases, 50% again? higher than we had during our last winter surge. And then also, there's kind of a mixed message because we're told in some sense that Omicron is milder, and yet we're seeing this crushing caseload, and now we're talking about hospitals being overrun again and staff being infected. So tell us, what about the disease concerns you if it is indeed milder?
Yeah. Well, Drs. Bishop and Jarrett actually described the phenomenon that we're seeing right now. Omicron is incredibly transmissible. It's far more transmissible than other variants. And because of that, and coupled with reduced precautions as a community, decreased behaviors, that has resulted in dramatic spike in the number of cases of Omicron. And I think it's very important to revisit this concept of severity. The research is still very immature. We're learning a lot with every day. One thing that's certain is that a big component of the severity picture for Omicron has to do with existing immunity. And that goes right back to what we've been talking about with an increasing number of individuals in the population who have been vaccinated. The severity in those patients when they go on to have a breakthrough infection is significantly lower. The risk of hospitalization is lower. Those who do end up hospitalized have shorter lengths of stay and require ventilation less frequently and have a lower risk of dying. That can't be underemphasized. The severity message around Omicron has everything to do with pre-existing immunity.
Thank you. Michelle, Dr. Hoffman, will you address, is this different than other pandemics, surges in the pandemic? We had the Beta wave, we had the Delta wave. Is this different?
The difference is the severe transmissibility of the virus. Because of this explosive growth, it's overwhelming systems that have been able to sustain and compounding the workforce shortages that happen when individuals who are running these systems in hospitals, in the public health system, at testing sites, are now calling off work. We're internally coming up with crisis staffing plans to continue essential services because Omicron's going to infect many, many people. They may not get sick, but they may not be able to go to work. We're going to be losing access to some of our critical services as a result of just the scale of infectiousness that we're seeing with Omicron. Our CDC models suggest conservatively an estimate of 12,600 cases a day by the end of this month. That's a conservative estimate. And I think it's surely playing out. We're almost at 10,000 today. So we're there. The maximum, that the outside estimate is about 38,800 cases a day. We're talking about explosive volumes of cases that overwhelm all of our systems. That's why that is different. So very much really having to get into crisis mode in many ways across multiple parts of our response. And as I mentioned, the one place we're not is in vaccines. We're only vaccinating a little bit more every day. You can't overwhelm our vaccine system. Please get out and get vaccinated.
Dr. Jarrett, thank you, Dr. Hoffman. Dr. Jarrett, there are questions and some mention has been made here of low staffing levels or hospitals being overrun. The question is asked, have we formally invoked crisis standards of care? What are we even talking about?
We have not gone into full crisis standards of care at our hospitals yet, but that's something that can happen and does happen locally. One hospital might be overwhelmed where others are not. We do have mechanisms in the state to try to load level as much as we can. But sometimes one locale could be hit harder than others. We are, I think, and I'll let Dr. Webb explain his comment, but he did mention something about crisis standards of care with as a respect to some of the scarce medications that we have. We do not have enough monoclonal antibodies or enough of the new novel antiviral pills to even put a dent in it. So we have to figure out some way to give those to the people where they will do the best good. And that is a crisis standard of care function. We have to dip into our crisis standard of care toolbox and use the tools that we've developed there. And I will just add that the state is doing as good as they possibly can on that with such a very difficult situation with the scarcity of these medications.
I might say that my understanding is that we had an oversupply of monoclonal antibodies until the Omicron surge really arose. But because Omicron responds to just really one or two monoclonals right now, those other earlier gen monoclonals are no longer very effective. Is that true, Brandon?
Yeah, the pressures on our ability to provide treatment are not unique to Utah. They are related to the features of Omicron, which, as you mentioned, is absolutely true. We have only one of the 3 previously authorized monoclonal antibodies that remains effective against Omicron. The other 2 that we had been leaning heavily on are ineffective. They play no role in treatment currently. And because of that, and because of nationwide shortages in monoclonal manufacturing, production, and distribution, and nationwide shortages in the production and distribution of oral antivirals, we in Utah are impacted with a significant limitation in the number of treatments that we're allocated. And so, like Dr. Jarrett mentioned, while in our hospitals, we're still in a various spectrum of contingency care, when we talk about outpatient treatment, where the ratio of demand to supply is far out of proportion, we are in crisis standards in terms of our ability to provide therapy to the number of patients who would otherwise qualify for those resources. Thank you.
Tracy, you've explained to us a rather dire picture of your staffing at the university. It sounds like a terrible crunch from the administrative side and certainly on the medical side. What would you advise people who are ill or have a family member who has a suspected or proven corona case or otherwise needs emergent or surgical medical care?
What I would advise is probably similar to what my wonderful colleagues have said already, which the first step is vaccination, right? We know that vaccination is incredibly effective in preventing severe illness and hospitalizations and death. So that is what I would advise. Beyond that, there's not a good answer to that. As we look at what is already happening just several days into this surge and the impact it is having on just our hospital system alone to care for patients, that is going to ripple across our state. It will not just be our hospital. I think our services will be limited. And then it really is a conversation about crisis standards of care, which, from an inpatient perspective, that means, similar to what we talked about with how we look at delivering some of the therapies that are available to us, we start looking at how we are delivering care in an inpatient setting. I mean, that is the very nature of crisis standards of care on the inpatient side. And that is not a place any of us want to be. I mean, that is probably one of the most difficult and challenging places to think about or to plan for, but we are actively in that space right now, right? We are talking about that and trying to figure out how we do this. We are likely looking at having to close more beds, but this is just starting. And so that is what we have to look at. So please get vaccinated, please be safe, wear your masks, stay home, get tested, and help us get through this so that we can take care of our community.
Dr. Bishop, let me ask you the similar question. What are you seeing? You're more in the northern part of the state.
I think, we have never stopped seeing COVID. We've, the public has perceptions of peaks and valleys, but, for us, it's been pretty steady, plus or minus a little bit. And we have not begun to see a huge increase in hospitalizations yet, but I anticipate that will follow as it always does. the case counts come first, and then 2 or 3 weeks later, we're seeing very sick patients in the hospital.
Would you advise people not to come to the emergency room if they need care?
No, absolutely not. I would, we want to take care of everyone that needs our help. And that's why I think a plea to, the community to help us, stay, capable of taking care of all of you is the message we want to send. I think for most ER physicians and, hospitalists and ICU doctors and the whole coterie of people who support us, respiratory therapists and nurses and phlebotomists and x-ray technicians, this is both the most exhausting and proudest moment of our career. And I think, I would be going against my moral compass to say, don't come to the hospital. We want to be there. We've trained to do this. We want to stay in the fight for people, but we also need to have the capacity to take care of people, as Tracy Nixon is talking about. We have to stay well, and we need the community's help, keeping enough people well that we can manage the flow in a reasonable way and give people the care they deserve.
Thank you, Dr. Bishop. Dr. Webb, what might we expect? Is there a thought that we can reach herd immunity because this variant goes through the population so completely and so quickly?
Right now, it's premature to really make projections about how this particular surge will play out. We do look forward to it peaking. We've seen that in other countries. We expect that the peak may be in the next 2 to 3 weeks. But as others have pointed out, when we peak at extraordinary numbers in terms of community transmission, hospitalizations and death are a lagging indicator. And like Dr. Bishop just pointed out, although we may see some peak and decline in transmission, that may end up being partly because of reaching some degree of herd immunity, if you will. It will be at a terrible cost, and the cost will be to those who are unvaccinated, and unfortunately to populations who are more vulnerable, immunocompromised, or in the highest of the high risk group. And we need to be able to preserve our resources and our ability to treat those patients as they require higher levels of care.
Dr. Webb, may I add something that I think following the case count is a very helpful metric in many ways, but the things that concern me as someone on the ground are, is that lagging wave. How many patients are we admitting to hospitals 2 and 3 weeks from now? And what does that do not only to those COVID patients, but to people who come in, in the middle of a heart attack, people who are involved in motor vehicle trauma because of the weather. I want to be able to take care of those patients too. And, long after that peak falls, I'm seeing the sickest of the sick in the emergency room. And so we need everyone's help on the front end to protect us on the back so we can be there for folks.
Thank you. Dr. Hoffman, what's the status of Utah's population vaccination?
Yeah, so we're at, let me just quickly grab the numbers on the adults vaccinated. 71.8% of Utahns 18 and older are fully vaccinated, but only 35.5% of them have had their booster shot. And we're hearing very preliminary evidence that we're seeing far more breakthrough infections with just the primary series, the 2 doses of an mRNA vaccine or the single dose of Johnson & Johnson, but far fewer for those who have been boosted. And so it's really critical that we close that gap between the numbers of people who've received their first primary series and their booster dose. We need to get all Utahns boosted now if they really want to contribute to reducing the case transmission rates of Omicron in our community.
Omicron, like other strains, seems to be quite arbitrary. It can kill a healthy 25-year-old and pass through an older person without long-term damage. It sounds kind of like a minefield. You're just taking your chances. If you're unvaccinated, running through a minefield one might go off and one might not. Is that an example we could use?
Yeah, I think it's a great example. And what vaccines do, it's like a dimmer switch. It just dims everything down. Getting vaccinated really does, because we can't say who's going to get it and who's not. It just dims the entire illness course and really unloads our hospitals from patients with severe illness.
Okay, thank you. While we have you, Dr. Hoffman, you're a pediatrician by background. Tell us how we're doing on the kids side of things and in schools.
So we had a little bit of a nice lull before the holidays with not too many massive outbreaks in schools. Beginning out the gate, we're already starting to see schools approaching the test to stay threshold, which frankly is already too late. With Omicron, we know that it's already gone through the full school at that point in time. We're just starting to see schools come online there. Our vaccination rates are looking fairly good. We have the good news of eligibility for booster doses for 12 and older now. And so we do encourage families to go out and get their children their booster doses. Currently, we're at 27% of 5 to 11-year-olds who've received their first dose. And we're at 64% of those 12 to 18 who've received their first dose. So that's, given how short a time that these vaccines have been available for some of these age groups, that's definitely decent performance. We need to still get more vaccinated. Children are in schools. They're largely unmasked at this time. It's voluntary masking, and it's spreading like wildfire, and they're going to bring it home to their eligible family, vulnerable family members. And we've seen that all throughout the pandemic, and we only expect that to be worse with Omicron.
Thank you. There are several questions about what healthcare professionals here believe the government ought to be doing, and I think I'll take that answer. Generally, we have come to the position as hospitals that this is an individual problem at this point. The policy options, we're not involved with what the legislature and what the governor intend on doing. We're here as health professionals asking every family to make wise decisions to protect themselves and to help protect their neighbors. The importance of this press conference today is to talk about Omicron, to distinguish it from prior surges, and to urge every Utahn to make a wise decision about getting vaccinated, or if they're not going to be vaccinated, understand that the therapies are very, very minimal, not only in number, but in availability. They're scarce, and you heard the odds are very, very small that you'd be able to qualify now because of production backlogs. The entire nation, the entire world is seeing Omicron, so we're not alone, and these therapies and drugs are critically short in supply. Okay, let's just go around the horn quickly. Dr. Bishop, Dr. Jarrett, Tracy, Michelle, and Dr. Webb in that order. What last words do you have?
Just thank you for the opportunity to be here. And, I live in this community. I'm proud to be a part of this community. It has great history of taking care of each other. And I think this is a new opportunity for us to do that now.
Greg, I'll just say that we've taken the step into this big unknown, the Omicron surge. By many indications, it may be a big abyss. We don't know, but it certainly feels that way, and we can't ignore it. We've got to pay attention to it. And I'll just say the same things that we've been saying all along, but now it's just ever so more important to get vaccinated. It helps. Many, many, many millions of doses have been given around the world. It is safe. We know what happens when you don't get vaccinated. The risks that you take by being unvaccinated are so much greater than any risk you might ever consider by being vaccinated. It's just, we plead with you, and we have no reason other than we want to help the people of Utah to feel better, to be safe, get vaccinated, wear masks. And for the next several weeks to several months, let's be careful about large gatherings and get tested.
I just want to say thank you to all of the team members that are involved in keeping our many hospitals across our state, both acute and post-acute, our testing sites, open and running. It is a Herculean effort right now. They've been doing it for 2 years plus. So deeply grateful. Thank you to everybody involved who stays with us and helps us deliver care to our communities. And then to our community, to add to what Dr. Jarrett just said, but we are here for you in all ways. We want to be able to help you and care for you. Please help us do that. Right, follow the recommendations, get vaccinated. We can get through this together, but it will take all of us doing our part.
Thank you. Michelle, did I mention you? Why don't you go, and then Dr. Webb?
I'd just like to express my gratitude to our public health system. We've always taken every available resource that we've had to maximize the health benefits to Utahns. That goes top down from our executive and political leaders to the front line of our public health workforce. And right now we are in a period of scarcity. We are running out of resources. We are not going to test our way out of this. We're not going to treat our way out of this. The one resource that is not scarce are vaccines, and people need to go out and get them. Thank you.
I'm not sure that I can add much. Those were tremendous comments, and I express my gratitude to the colleagues on this call and throughout the state who are at the front line battling this disease. COVID is a team sport. And I think for me, the single most important takeaway that I would wish to share with others is engage. Now is the time to engage. There's no single policy or prescriber or political position that can by itself resolve this crisis. The way this crisis is resolved is by the community pulling together with the healthcare system and with the public health and with our policymakers to together engage and to do what each of us can do and to control what each of us can control. For most members of the community, what you can control, you've heard now. We have unlimited supply of vaccine. We have important behavioral decisions that we can choose to make to protect those among us who are most vulnerable. And by doing that, we can engage together with the healthcare systems and the Department of Health and others to combat this terrible Omicron surge.
Thank you, Dr. Webb, Dr. Hoffman, Dr. Bishop, Tracy, Dr. Jarrett, my esteemed professional colleagues, and thanks to the media for being here today. We very much appreciate your interest. And I'm sure if you contact each of the systems, they'll be able to give you follow-up information or provide further interviews should you wish. Thank you so much.